Welcome to One Sharp Sword, cutting through to what matters most. I'm your host, Dr. Wayne Pernell, the exponential success coach and founder of Dynamic Leader. I've got an amazing guest today. His name is Keagen Hadley, and he has a doctorate in occupational therapy, which I guess I didn't, and I'm certain that a lot of people didn't even think about or know about. Dr. Roti, he specializes in psychological conditions, and he is actually the bridge between the physical and the psychological when focused on pain or returning to comfort. He tells me that most people focus on one or the other, and that fascinates me. So I'm hoping it fascinates you. Welcome to the show, Keagen.
Glad to be here. Thank you.
Okay. Keagen, tell me, Dr. Hadley, tell me about what you do. And then what I want to do is wind back the clock a little bit, and you'll talk to me a little bit about how you got to doing what you do. And then we'll talk a little bit about what our listeners and viewers should know in terms of their physical and psychological well-being.
Yep. So essentially, I spend a lot of my time talking with athletes or active individuals who have suffered a physical injury, generally, that is really taking a psychological toll on their day-to-day lives. So I help them kind of zoom out of their life and see, you kind of have to address both the psychological and the physical in parallel. Otherwise, you're not going to really get back to where you were or improve in the future. So I spend a lot of my time doing that.
Well, I'm a big fan, I suppose, is the word. I'm a big believer in the mind-body integration. Mind-body biology was something that I studied in my undergrad, believe it or not, and that was many decades ago. Mm-hmm. And that, it makes all the sense in the world. We focus on, recovering from an injury, but there are always psychological components to that. What do you do? Like, are you in your world, someone who comes to you, an athlete that has, you're known also as the ACL therapist. So talk to me about how people find you, what you do to them, with them, for them.
Yeah, of course. So generally, people find me after an injury that requires a long recovery period, like an ACL injury, an Achilles injury. For throwing athletes, sometimes it's a Tommy John injury or total knee individuals as well, depending on their age and activity level, and they just reach out to me because they're searching either social media or just the internet to find out more information as far as their current condition, or they resonate with my book Torn: Overcoming the Psychological Challenges Post ACL Injury. Just kind of there's not many people speaking directly to individuals who are struggling psychologically as a result of physical injuries. So
that's true. So how long would someone work with you? Are you seeing them as a psychologist, as a psychotherapist might see somebody, and is that over the course of months, or are you seeing them as somebody doing physical rehab, PT, right, and OT?
Yep, it kind of depends on the individual. So my main intervention that I practice, from a psychological perspective, is ACT, acceptance and commitment therapy, which it heavily integrates into the physical well-being of the individual. And if one of the struggles of the patient isn't necessarily psychologically focused, I also spend a lot of time training them from a joint perspective, because as a result of my own experiences, I've kind of had to find ways, especially for the knee joint, to strengthen it in more unconditional ways to feel better after these more extensive surgeries or injuries. So
So,
And as far as timeline, I guess I didn't necessarily answer that. It's heavily dependent on what the client needs, because it's not, unfortunately, a one size fits all. So, I mean, some people I spend, a weekend just connecting with them. A lot of people just need connection, and to talk through these kinds of situations with someone who has been in their shoes before. Because even though obviously, there's a lot of different cultural things, or what have you, that might be different between myself and the client, but from an experience perspective, just as a result of these traumatic injuries, we can have a lot of common threads. So and if they're just looking for someone to connect to, it can be rather brief. If they're looking for kind of extended help to get back to where they were and hopefully improve upon where they were prior to the injury, it can be months. I've talked to one client for a year and a half now. So, I mean, it just kind of depends. Unfortunately, I can't give you a concrete answer.
No, I think that's actually a better answer.
Okay.
It really is. It's like, people see me and they come in and we do this, and they're done. It's like, I'd rather hear that you treat people kind of based on who they are and how they are when they show up. So that, I think that's great.
Yeah. And I truly believe in, getting people the skills they need to kind of set them out and live their life. I don't generally, I'm not just going to see people to see people. I'm more so trying to solve, issues and struggles they're having internally, and then set them out and, let them live their life, essentially.
Set them free to live their lives.
No.
Talk to me a little bit about, it's a great acronym, ACT. Talk to me about acceptance commitment therapy. What is that?
Acceptance and commitment therapy is essentially kind of like essentially a cousin to CBT. They work hand in hand. A lot of the principles are similar. It's just kind of a different frame of reference. Essentially, I can get into my history a little bit, but
what are they accepting when you're talking about acceptance therapy or acceptance and commitment? What are they accepting? What are they committing to? And how is that therapeutic?
Yep. So essentially, it depends on how you define the word accept. A lot of times when people think of accept, especially in reference to mental health, they're thinking of stand in the corner, be quiet, just accept what happened to you. And that's not really the case. It's more so using what you've gone through as a learning tool to go, okay, this happened to me. This is what I can pull from it to ensure it doesn't happen again. And then, get a really realistic look on where I'm at and how to move forward from, my previous traumas. And as far as committing to it, just like any kind of person, in recovery, whether that be, from a mental health issue, a substance abuse issue, you have to commit to change, because it's not a one decision and you're done. I mean, because we'll all fall. This is a fallen world. So, I mean, we're all going to make mistakes, and you always have the opportunity to either get back on the path or completely kind of tumble back down the drain, essentially. So.
And the therapeutic part is the path that you keep people on.
Yep. There's 6 fundamental pillars associated with ACT, or psychological flexibility. And I'm happy to kind of go into those if you're wanting to do that, I suppose.
Yes, please. I think, anything. Here's what I'm looking for. I'm looking for something that our audience can go, oh yeah, that's me. Or, oh yeah, I should probably, right? And so 6 pillars, at least one of those 6 is going to be relatable, I'm guessing, if not all 6. So
yeah, usually people have like 1 or 2 strengths, is what I'm seeing when someone comes in. Essentially the slight difference, because I'm sure your audience is at least somewhat familiar with CBT, is essentially CBT generally is trying to reduce the negative symptomology associated with whatever they're dealing with, whether that be depression, anxiety.
Actually, for the sake of the audience that's not familiar with it, cognitive behavioral therapy is what Keagen is referring to. And basically what that says is you are really looking at how you think. How do you think
Mhm.
And so it's you stepping back and going, oh, this is how I think. And then based on your recognition of your thinking style, you then modify your behavior. And this works whether you are facing anxiety
Mhm.
or whether you're facing a heavy challenge that
Yep.
you want to overcome, any kind of challenge. So
Mhm.
cognitive behavioral. And you're using that as kind of a foundation, Keagen, it sounds like, to
just to compare. So essentially what you're trying to do generally is a 10,000 foot overview is you're trying to reduce the symptomology associated with your condition with CBT. You're trying to reduce the symptoms associated with anxiety, depression. With ACT, you're essentially not necessarily trying to reduce the, never, in my view and in my experience, I have a hard time. Everyone kind of has a modality or an intervention they prefer, essentially. And mine, I've had a hard time with CBT, cognitive behavioral therapy, and that kind of leads into my story a little bit. But acceptance and commitment therapy, or ACT, essentially is just preparing you for the inevitable, kind of, because no matter what your situation is in life, you're going to deal with difficult circumstances, whether that's losing a loved one, whether that's a job loss, whether it's struggles in certain relationships like a marriage, a family member, those kinds of things. It's just preparing you for those things and allowing you to live with the difficult feelings associated with it, the human condition, I guess. So
let's talk about the 6 pillars.
Yep, the 6 pillars. So there's kind of the 3 different stages, essentially. There's diffusion and acceptance are the first 2. So diffusion would essentially, it's one of the foundational principles that really helped me out when I was in a very dark place. Diffusion is the thoughts that we all have that we very much cognitively fuse with. So for me, I'll just give you my own personal example. I always feel that's best. So I always felt like, as a result of my mental health challenges and then my physical challenges, I tore both my ACLs playing college football, and briefly afterward, that I was broken. I always had the terminal thought of I am broken, which I am not physically broken. I am having thoughts or feelings of being broken. And that's the process of diffusion, is being able to gain some perspective on those thoughts and step away from them and say, I am not sad. I'm having thoughts and feelings. I'm sad, and so on and so forth. And acceptance is the other one, as we alluded to. It's not standing in the corner, just, accepting what happened to you. It's learning from what you've went through and how to, best position yourself for the future. And then I can keep rattling on. I don't know if you have any questions.
I will interject as long as you pause for a second. I jump all over the separate thoughts from and separate judgment from the person. And I that's a huge recommendation that I make when you are in a position of authority also. And if you, if you're overseeing a company, for example, and this is to, the audience here is quite broad. So if you're overseeing a company or overseeing people in a company, recognize that the behavior you're seeing is not the person. If you're overseeing a family, recognize that, sometimes your kids are doing their best, or your spouse is doing his or her or their best. And their behavior is not the person. And then back to yourself, it's sort of like, well, I did this thing, and then you jump to judgment about the thing. And it's like, now separate yourself, your core self, from those thoughts, and to recognize that around the behavior, you have choices. And so that's really the first step. And I wanted to elaborate there, because I think that is something that we can talk about at a high level, but it's also something that you can use right away. Just recognize you have choice about the way you think, you have choice about the way you act. And as long as you're paying attention your awareness leads to greater choice. So cool.
Mhm.
All right. So we've got diffusion and acceptance, and you did
Yep.
talk about acceptance before. So
Yep.
What's the next section? The next.
The next group of two is mindfulness, which a lot of people are much more familiar with. A lot of people who are struggling in the kind of mental health arena, it's generally because they're focusing either in the future or the past. So living in the moment helps quite a bit, and there's a lot of skills I work with, with clients to really stay in the moment, which is extremely difficult, especially when there's 300 new series on Netflix, a million new social medias, and all the different chaos we're living through presently. That's one, and then kind of one of the other one is one of the more nuanced pillars. It's self is a context. It essentially posits that we each live every day with two versions of ourself. There's kind of the mask that we put on, that generally is more widely seen. So essentially, if you think of like stereotypes from the standpoint of a football player being strong, tough, maybe mean sometimes, not a lot of feelings. But that, if you really take a step close and look at me or, a lot of other individuals, there's really who they are. So it's underneath that mask. It's it's kind of removing the, veneer that you're trying to put out and seeing what's really underneath. So,
well, and we see that with influencers, quote unquote influencers in social media.
Yeah.
We see the highlight reels. We don't see how they got there or what happens day to day. That the going shopping to using the restroom. It's like they're human. They're human, and so being able to say, okay, there's the persona we put out there, and then there's the actual humanity. Who am I really?
Yep.
So good. Self as context. That's awesome.
Yep. And then the last two are purposeful action, because, without that one, obviously, no matter how much internal work you're doing, unless you take action, you're not going to see any progress. And then the last one is values, which essentially the best way I like to explain values is goals are extremely important. But what I found personally, and what I've noted with a few of my clients as well, is unless your goals are tied to your internal values, even if you achieve a goal, if you don't have a value underneath it, it's going to be, rather meaningless. So essentially values are your compass. So due north, but you'll never reach it. You're never going to get to the, true north. But the goals are essentially the stepping stones on your way in that direction.
I'm so glad you said that. When I talk about exponential success, I talk about values first, always values first, because if you don't have clarity around that, how do you have anything else, right? And who you are now isn't who you were or what you valued 20 years ago. Think about what you valued 20 years ago, what you value today. And that sets the foundation for where you're going. What do you need to value, and therefore who do you need to be? Values, vision, vitality are my three. And you've got values, purposeful action. I'm glad you said that too, because two things. I love that phrase. Taking action, that's great. Taking action teaches you. Like those people they're so overthinking. If you find yourself overthinking, take a step in some direction and you'll learn. And if you know what you're really after, be purposeful about it. Like be really clear, be purposeful. Like, is the action you're taking, is that getting you closer to or further from your goals? So I love everything about this. This is diffusion, acceptance, mindfulness, self as context, purposeful action, and values. Those are 6 good pillars, Keagen.
Yep. Yeah, certainly. Yeah, it's definitely helped me on my journey, and it's been an absolute pleasure to help others, give them the tools to live a more full life, for sure.
You know you are bigger than the life you are leading. It really is time to attend to that thing you've wanted to do or have, but you've been putting off. It's time to step into that dream you've parked for someday. It's time to claim true well-being, both personally and professionally, without giving up the success that got you here. It's time to check out Dr. Pernell's signature small group retreat, the Exponential Success Summit. Explore exponentialsuccesssummit.com. Seats are extremely limited as this is a very special small group event. www.exponentialsuccesssummit.com.
Talk a little bit about your book.
Yeah. So essentially what happened with me is I'll give you that because it'll kind of explain why the book is a thing, I guess.
Tell me the name of the book once more.
Yep. Torn: Overcoming the Psychological Challenges Post ACL Injury.
Nice.
So the book essentially is my story starting from when I'm a freshman in high school, struggling with very severe anxiety, panic attacks, those kinds of things, through both ACL tears in college and then in the football after college, and then kind of the subsequent emotional abusive relationship I was in that led to me being suicidal for a time. So essentially, it kind of just outlines that and how if I would have been practicing ACT throughout my life, I would have been much better suited for all those situations, and I would have been able to avoid, many of the more serious situations that I ended up being in.
So the book,
Mm-hmm.
What does it walk people through? Is it autobiographical?
It's essentially a bit of both. So I like to have multiple. I like to break up my books from a story. So you'll have a story of me playing football, and then that abruptly ending and the obvious turmoil that leaves you in, and then explaining, how this situation could have been changed with ACT. I kind of introduce ACT because it's not a widely known intervention. Through my stories, if that makes sense. So this story would be ACT, and so on. So
it would be Act 1.
Yeah, essentially. So that's, unfortunately, I really wanted to, what frustrated me is this book actually took shape from my own personal journaling through therapy. So I mean, the process of me deciding I wanted to publish a book to having a book was a very short turnaround, just because I had most of my stories already in place from my journaling. I just had to accumulate the literature, because I wanted to be, thorough with my scientific background as well. But it was a short turnaround, anyways. So
yeah, that's great. If do you feel like people have to be in pain in order to recognize or use all this?
No, I mean, essentially, like I said, no matter what you're doing is in life, there's going to be challenges, and to be best suited for those challenges, you're going to have to do some kind of mental preparation. The reason I came upon it so abruptly was because football was my coping mechanism. Once that was removed, like many other athletes, we don't spend a lot of time as athletes talking about mental health and how to, really cope in a healthy manner if you're going through some stress. So I came upon that rather naturally, and I dealt with everything in a very unhealthy way. And I know that's unfortunately uncommon. Or common.
It is. It's more common than most people know, and that's, in some ways, that's good news. It's like, if you're, as you watch this, as you listen to this, just to recognize that if you're going through something, you are not alone. This is like, pain happens, and life's ups and downs happens, and
yep.
That's part of the acceptance piece, is to recognize that there is flux, and And, Keagen, I'm pretty sure when you talk about preparing for the inevitable, it's not like get ready because something bad's going to happen. It's just like life has ups and downs.
Yeah, and to live a full life, I mean, you're assuming that's going to have love involved, and usually the most difficult pain we can experience is a result of something you love, whether that be something you lose a loved one. I mean, would you really rather not have that loved one and then truly love someone and then know what it's like to lose them? I mean, you'd want both sides of that, and to live a full life, you have to experience both. Like I very much loved my grandmother who passed away earlier this year, and it was excruciating, but I never would have given up knowing and loving and getting all the wisdom I got from my grandma in order to not have that pain. Unfortunately, nowadays people tend to associate feeling bad with being unwell, but I mean, in a lot of cases, I mean, it's a very healthy situation. I mean, if I very much loved my grandmother and I lost her and I wasn't upset at all, I would be more concerned about me in that situation than if you were grieving. So, and
people grieve in all kinds of ways. The point here is, that the risking feeling is a wonderful part of the human condition. Right? That's awesome. Good. What else should we be talking about? This is that's a lot to cram into a short amount of time.
Yeah. Well, I mean, one thing that I'm terminally struggling with, and I touched on it briefly, is being mindful. I'm one of those people. I'm a writer, and the reason I enjoy it so much is because I have so many thoughts and so many things that are always vying for my attention that it's very hard to live in the present moment. So it's something I'm always very, very passionate about, because it's very, very difficult to do nowadays. So.
And what suggestions do you have for doing that? What, if you were to say, to be more mindful every day, here's something you can do for yourself.
It would depend on the individual. If it's someone who's having no issues presently, because I mean, there are two totally different tracks you can go down. There's someone who's more like me, where you have potentially a panic attack and you're having to be mindful, sit through the panic and be there with that difficult emotion. Or you have someone who potentially hasn't experienced that kind of thing and they're not accustomed to difficult emotions or feelings. If you're more fitting into that camp, which that's a good thing. I'm not saying it's a bad thing by any stretch of the imagination, but the easiest way to simulate that and kind of train that muscle, I guess, would be the only way to term it, is what I found is, even if I'm doing very well mentally at the time, I like taking cold showers, because it's not my favorite feeling in the world. But if you can sit there and enjoy those difficult feelings, you're more well suited to taking on difficult emotions, difficult stresses, and those kinds of things, and being present in that moment, even if it's not super enjoyable. So doing like a progressive overload from a training perspective in cold showers is a very easy way that anyone can kind of start to work on those being present skills.
It's great. You're using terms that are familiar to you and not as familiar to our audience. So progressive overload, for example, it's great. It's
I can explain it if you
do, please. It's it's a great term, and I think it's almost self-explanatory. I just didn't want to throw it out there, it's great.
Yeah. So essentially, progressive overload is something more in the physical either training or physical therapy world, or just strength and conditioning world. Essentially, it's alluding to the fact that we have very resilient bodies. And this week, if I'm doing a bicep curl at 10 pounds and I break down that muscle, you get sore. The next week, I might do 12 and a half pounds, and it'll still likely be hard, but because you broke down that muscle the week before, it'll come back stronger. So you're progressively very incrementally getting stronger. I use that principle for all my joint training. I try to implement as much of it actually on the psychological side of things as well, just so you're not going from 0 to 100. A lot of people struggle with that, doing nothing to doing as much as possible right away. So I like to provide everything in bite-sized pieces.
Perfect. That was a great example. It's not like, hey, I've heard cryotherapy is good, or I've heard ice baths are great, I'm going to just jump right in. It's like, start by standing in the shower and turning the dial down just a little and turning it down just a little. And then in terms of the mindfulness practice, it's not like you stand there and you turn the dial down so you're in cold water and you're cussing out the cold water. The mindfulness piece is, what am I experiencing? How's my breathing?
What
do I think my heart rate is? How long can I stand here? What's happening with my muscles? Are they shivering? What's my breathing? Like, start to pay attention. And that's the piece that allows you even greater control over, can you make it colder? Or can you lift that extra pound or do that next set? So this is all perfect. This is really great.
Yeah.
Great.
And it's you can do it multiple different ways. You can do it in the way Dr. P is alluding to, where you get slightly colder each day for your shower, which is a good way to do it. What I generally have done in the past, it's kind of actually almost the opposite, is you go cold, but you're in there for 5 seconds that first day.
Okay.
So I mean, there's two different ways you can do it.
No, just increase increase time. That's great. Go.
So it's one or the other.
Ice bath for 1.5 seconds. That's wow, that's cold, and out you go. Ice bath. Wow. Okay. Yesterday was only 2 seconds. Today is 5.
Yes. Awesome. So you can do it either way, and actually, it's probably less aversive if you're doing it the way you're alluding to. Actually, so that's a good note for myself personally.
Either way, and that is good, because and here's what's great about this is that I have different experts on One Sharp Sword podcast, and we talk about things. And we sometimes get to the same result from different angles. And I think that's what makes all of this so interesting, is that there are so many ways to do things right. It's not like any particular style is going to be like, oh my gosh, you did that. That was terrible. It's like, are you living your life? That's like, be aware of how you're living your life. That's mindfulness. Ta-da! It's like you're a step closer to the self-awareness. And then, I'm a big fan of awareness does lead to choice, and choice leads to greater awareness. And it's a beautiful outward spiral. And so as you learn more and you get more, different ideas about how to do things in your life, great, you have more power in your life, and that's the whole point, right?
And that's how I came upon ACT just as a whole. I got done with that more difficult period of my life after I tore my second ACL. I made a poor relationship decision and started dating an alcoholic who was emotionally abusive, and then it ended up with me being suicidal. And I actually, the most frustrated I ever was, it was after I got out of that relationship, started going to therapy. But the reason I got so frustrated and actually the most down was because just personally, I wasn't having any success with cognitive behavioral therapy for whatever reason. I think it's just my brain, until I found acceptance and commitment therapy. And I slowly started to climb out of that hole. And it's not because there's thousands of research studies on cognitive behavioral therapy, and it's how effective it is. It's just everyone is slightly different. So, I mean, just kind of echoing what you said is, as long as we're all getting to a better, more well place, there's a lot of different routes to get there.
A lot of different routes. I love how you're almost, this is going to sound really weird. And I'll just blurt it out. You're almost smiling when you were saying, I was in an abusive relationship and almost got suicidal. And it's sort of like, right now you're at the point of having processed it so much that you can go, how absurd was that, which is what the smiling's about. It's I was in this place, it was a dark place. How absurd to have let myself get there. And it's like only now in this place of mindfulness, in this place of health, can you look back and go, oh, dang.
Mm-hmm. And I'm also, again, as you stated, it's almost weird, but I'm actually almost thankful for that period of time, because it led me down this path, and I get a lot of I'm very content helping others avoid those kinds of situations as best I can by providing them these tools. So it's provided me a lot of joy to help others. So I'm actually thankful for that time in my life as well.
So I think that goes back to there's no failure, there's only learning if you allow yourself that gift. Mm-hmm. And I think that's huge. No one goes into a relationship going, hey, I wonder how messed up it's going to make me. Or no one also goes into a relationship going, I wonder when we're going to break up. It's like you don't start with some turmoil in mind. Mm-hmm. And so I think the commitment is great. And that's whether that's a commitment to a work, an area of focus, a hobby, another person, or to yourself. I think that all of that is so important that you're like, you know what, I'm going to commit to this and I'm going to learn along the way.
Mm-hmm. Yep. It just lessons, not failures, just lessons.
Exactly. Anything that you want to impart at this point that we haven't covered, and or how do people find out more about you?
Yep.
Yeah.
Nothing that we haven't discussed. Again, I'm always open to having more discussions with you, Dr. P. It's been a pleasure. But if anyone wants to find me, they can find me at the ACL Therapist on Instagram and Twitter. I'm not as active on them as I should be, but I do respond to messages in due time. And I also have my website, the ACL Therapist, or another one is KeagenHadley.com. So.
Okay. The ACL Therapist is also .com?
Yes, sir.
Okay. Good deal. And ACL stands for?
Anterior cruciate ligament. It's the main, it's one of the four main stability ligaments in the knee, and it's the most commonly injured in athletics.
You just touched your knee when you talked about it, didn't you?
I did. You felt it. You felt it, didn't you?
Right? It's like, it's the ACL, and you lean forward and you touch it. It's like you have to, right?
Yeah,
That's awesome. Mm-hmm. That's so good. Mm-hmm. All right. The ACL Therapist, Dr. Keagen Hadley. Either of those is .com. The ACLtherapist.com. Keagen and Keagen spells his name, or his parents did, spell his name Keagen, Hadley, HADLEY.com.
Yep, it'll both take you to the same place. So
yes, they will.
Yeah. Thank you.
Yes, they will. Awesome. Also on all the socials. So very good. Wow. The book, the resources, all the stuff. Dr. Keagen Hadley, thanks for joining me.
My pleasure.
Yeah, appreciate having you here. This is One Sharp Sword, cutting through to what matters most. My guest has been Dr. Keagen Hadley. I am Dr. P, Dr. Wayne Pernell, the Exponential Success Coach and founder of Dynamic Leader, Inc. We'll see you here next time. Thanks for joining us.